Vietnamese American Arizona Television. Hello everyone, welcome back to our weekly special investigative report program. Here we provide you with in-depth news on science and education topics that are relevant to your daily life. In the previous shows, we discussed about remdesivir, the only medication approved by FDA for the treatment of COVID-19 infection. The vaccine race, which Dr. Fauci, director of NIH, said will likely be available either near the end of this year or beginning of next year, and the importance of wearing masks to mitigate the spread of SARS-CoV-2. If you have not had a chance to view those shows, we invite you to visit our website at www.vaatv.com to watch those episodes. Over the last month, there were many articles written about the healthcare inequalities. I could not help but wonder what it is. We are living in the United States, the wealthiest country in the world. The rich easily can afford the healthcare cost. The middle class usually are working for companies and therefore get their health insurance through the company's sponsor vendor. The poor class usually are supported by Medicare or Medicaid. It seems everyone in the US has healthcare. So what is the concern for the inequality of healthcare? Fortunately, we have Justin, who has researched on the topic over the past week. He returns to our studio to shed some light on this topic. Hi, Justin. Welcome back. How are you?
Thank you. I'm good.
Okay. So now, when I was reading article on the inequality of healthcare, I often come across the word socioeconomic status and financial status. Can you explain these terms?
Yeah. So socioeconomic status can be seen as a group of variables such as education, occupation, where you live, and your financial status. So financial status itself is considered a component of socioeconomic status.
So the financial status is how much money I have, and socioeconomic status is what job I have and where I live.
Yeah.
Right? Yeah. So how does socioeconomic status affect one's health?
So to answer this, we can look at two big components of socioeconomic status. First one being income, and the second one being area of residence. So generally with income, there are a lot of studies showing that poor people generally have to spend a lot more of their income as opposed to wealthier people who have to only spend a smaller proportion of their income. For example, this was shown in a 4-year study published by the American Public Health Association in 2018, and it showed that in a single year, the wealthiest 10% of Americans had paid only 3% of their yearly income on healthcare, while the poorest 10% had to pay nearly half of their yearly income. Because of this, the lower socioeconomic status are unfairly forced to reallocate their money from other important aspects of their life, such as education and where they live. And in addition to this, there is significant evidence showing increased geographical segregation by income. And this pushes those of lower socioeconomic status into more rural areas or environmentally unjust communities. And as a result, their access to healthcare becomes even more diminished. Currently, there is an overwhelming shortage of primary care providers in rural areas, especially in Arizona. And this means that those living in these areas may potentially need to drive very far into the cities in order to receive the medical care they need, while those of higher socioeconomic status with higher incomes living in more urban areas most likely have a hospital within 10 to 15 minutes of where they live.
So poor people spend proportionately more of their money to pay for the health care, and they usually have to travel farther to find available doctor. But they still can get the same quality of care, don't they?
So that's a little tricky. Even if those in rural areas are able to see doctors and go to hospitals, with a shortage of physicians in those areas, doctors providing care in these communities may end up overworked, and therefore their ability to provide quality care to these patients may decrease. In these areas, doctors may also not have the same technological advances as wealthier communities, and this lowers the quality of care even further.
Interesting theory. Is there any supporting evidence?
Yeah, so there are two big pieces of evidence I want to bring up here. First, there's a very clearly established correlation between income and life expectancy. For example, in 2016, there's a study published in the Journal of the American Medical Association showing that life expectancy of the wealthiest 1% of individuals in America is approximately 10 to 15 years longer than the poorest 1% of individuals. Second, according to an article in The Lancet, there are many studies showing that the life expectancy of middle income and high income Americans are increasing, while those of low income Americans have begun to stagnate and are even beginning to decline.
Sound like a universal health insurance in which everyone has health insurance would solve the problem, right?
That's another tricky issue to talk about. So health insurance is, even in a perfect scenario where a person is able to afford health insurance, there are many scenarios in which people aren't covered for the medical expenses that they are charged. This is because a lot of medical insurance companies are very picky in what conditions they may cover or what treatments, what facilities, and which doctors they accept with their insurance. And because of this, even with health insurance, many people might have to end up paying for their own medical expenses anyway. And in addition to this, health insurance itself is very expensive, and this prevents those of lower socioeconomic status from receiving the medical care they need. And as a result, all of these variables come into play to make healthcare inequalities even worse for these individuals.
So what do you think is the solution?
So I think a really big thing that we can do is educate the people around us, especially future doctors, policymakers, and other leaders. This way we'll be able to pave the way for a better healthcare system in the future, even though it might be slow progress. In addition to this, by educating people and understanding how these issues affect those of different backgrounds, we'll be able to lead the way for more informed support systems. For example, in New York, there's a big issue surrounding those of lower socioeconomic status and smoking. So in order to fight this, policymakers decide to put a big tax on cigarettes, which not only discouraged those from purchasing cigarettes themselves, but it allowed people to use those taxes to fund educational programs and advertisements to help people understand why smoking has such negative consequences. And it was only by understanding how these issues affect those in regards to healthcare that they were able to come up with such a solution.
Thank you, Justin, for sharing with us your research.
Of course.
We are living in the United States, one of the most civilized countries in the world. Inevitably, we must ask a fundamental question. Is healthcare a right or a privilege? At its core, each of us should have equal access to the quality healthcare. Your livelihood should be equal to that of mine. This is not a political concept. This is not a capitalism. This is not a socialism. All of us have the right to live a healthy life. It is a simple truth. This is Linh Vi and Justin. Goodbye and see you next time.
Linh Vi xin cảm ơn sự theo dõi của tất cả quý vị trong những giây phút vừa qua. Chương trình VAATV xin kính chào, tạm biệt và xin hẹn gặp lại quý vị vào lần phát hình kỳ tới. Mọi chi tiết về thông tin thương mại và bảo trợ, xin mời quý vị hãy liên lạc về địa chỉ email vaatelevision@gmail.com và số điện thoại là 480 289 9816 480 289 9816, website vaatv.com và vaaznews.com. Xin kính chào, tạm biệt.